Good morning, everyone. How's everybody this morning? I hope everyone is doing well. I thank you for tuning into my channel this morning. Again, this is Robert Louis from the Lens Makers Optical in Hamilton, Canada. And our main topic for this morning is all about myopia and hyperopia. Myopia is a medical term for nearsightedness, and hyperopia is a medical term for farsightedness. Okay, before we discuss about the difference between myopia and hyperopia, I would like you to understand how light goes into a normal eyeball, okay? The diameter of a normal eyeball is around 24 to 25 millimeters, is less than an inch, okay? The reason why I would like you to know the diameter of a normal eyeball is when I'm talking about myopia and hyperopia, I hope you will understand a little bit more, okay? So if I can show you a diagram of a normal eyeball here. So this is a normal eyeball, around 24 to 25 millimeters in diameter or less than an inch, okay? So when the light goes to a normal eyeball, the light will focus at the back of the eye. They call it retina at one point, okay? So this one here, these are the light rays going in and they focus at the back of the eye at one point. So this is a normal eye, okay? They don't need any correction. They don't need glasses. They don't need contact lenses. So that's a normal eyeball. When the light goes into a normal eyeball, it focuses at the back of the eye. They call it retina at one point. Okay, so let's compare myopia or nearsightedness to a normal eye. So what is myopia anyway? Myopia is a condition of the eye wherein the patient or the person, when they're looking objects away from them, it's a little bit fuzzy or blur, or it's not clear. But when they're looking objects close to them, it's very clear. Okay, so that is myopia. They have a problem seeing far, but they don't have any problem seeing close. Okay, so why do people or patients have myopic eye? There are two main reasons why we have a myopic eyeball. Okay, one reason is the eyeball is longer than normal. Remember, the normal eyeball is around 24 to 25 millimeters or less than an inch in diameter. But if you have a myopic eye, your eyeball is longer than normal. That's one reason. The second reason is the cornea, the front clear surface of the eye, they call it cornea. It's a little bit too stiff or too curved. Okay, so these are the two reasons why we have a myopic eye. Okay, if I can show you a diagram how the light goes into a myopic eye is like this. Okay, so this is a normal eyeball. Okay, the light goes into the eye, it focuses on the retina at one point. And the second diagram here is a myopic eye. So when the light goes into a myopic eye, it's not focusing at the back of the eye. It focuses at one point in front of the retina or the back of the eye. Okay, that's the reason why a myopic eye cannot see distant object, okay? Because the light that's going into the eye, it's not focusing at the back of the eye. They call it retina. And actually, the retina is connected to the optic nerve, which transmit light sensation to our brain so that we can see what we're looking, okay? So how do we correct myopia so that the person can see a lot better? There are three correction or treatment that we can use for myopia or nearsightedness. One is by wearing eyeglasses. Second one is by wearing contact lenses. And the other one is surgery, or we call it LASIK surgery, okay? In terms of glasses, we use a minus lens or a concave lens. What a concave lens do, when the light hits a concave lens, the concave lens will diverge the light or widen the light first before it will reach the eyeball, so that it will help the eyeball refocus the light at one point at the back of the eye. They call it retina, okay? So if I can show you a diagram here again. So this is a nearsighted eyeball here, okay? So when the light goes into a nearsighted eyeball or myopic eye, it's not focusing at the back of the eye. It focuses in front of the retina at one point. So to correct that by eyeglasses, so imagine this is an eyeglass lens, okay? It's a concave lens. So when the light hits that lens, you can see it's diverging or widening the light first before it reaches the eyeball. So that it will help the eyeball to refocus the light at the back of the eye. They call it retina. So it will become like normal like this, okay? So that's how eyeglasses correct myopic eye or nearsightedness, okay? Okay, in the case of contact lenses is a very thin curved lens wherein we put it on top of the cornea and it rests on the tear film, okay? Contact lens, what it does is just masking the shape of the cornea, and that's how it's correct myopic eye, okay? And in terms of surgery or LASIK surgery, what they do is they just reshaping the cornea so that it will make a little bit more flatter in the case of myopic eye, okay? So that's how surgery correct myopia. So those are the three treatments or correction being used to correct myopia. Okay, so let's go to our next topic, which is hyperopia or farsightedness in comparison to normal eyeball. So what is hyperopia? Hyperopia is a condition of the eye wherein the patient or the person can see objects away from them so clearly, but they have a problem seeing objects close to them. So basically, it's the opposite of myopia. So what are the causes of hyperopic eyeball? Okay, so there are two reasons why we do have a hyperopic eyeball. One, the eyeball is shorter than normal. Okay, remember a normal eyeball is around 24 to 25 millimeters in diameter. Comparing to a hyperopic eyeball, the eyeball is shorter than normal. That's why when the light goes to a hyperopic eyeball, the light is not focusing on the retina. It focuses behind the retina. Okay, so the next reason why we do have a hyperopic eyeball is the cornea. The clear surface of the eye is too flat. Okay, so these are the two reasons why we do have a hyperopic eyeball. If I can show you a diagram so that you can see a little bit or understand a little bit better. So again, this is a normal eyeball, okay? When the light goes into a normal eyeball, it focuses at the back of the eye. They call it retina at one point. So this is normal. And this is a hyperopic eyeball. See, it's short. The eyeball is shorter than normal. That's why when the light goes into the eye, it focuses behind the retina. Okay? That's the reason why the patient or the person is having a problem with close vision. Okay? So this is hyperopic eyeball. When the light goes into the eye, it focuses behind the retina compared to a normal eyeball. Okay, now, so how do we correct hyperopia? So we correct hyperopia by using reading glasses. It's simple, okay? Or we call it plus lens or convex lens. So what does a convex lens do to the light? So when the light hits a convex lens, what it does, it will converge the light, or it will make the light narrower before it reaches the eyeball, so that it will help the eyeball refocus that light on the back of the eye or the retina. So if I can show you a diagram here, I think it's easier for you to figure it out. So this is a hyperopic eyeball. So when the light goes into a hyperopic eyeball, the light focuses behind the retina at one point, okay? So this is a normal eye. It focuses in the back of the eye or the retina at one point. And this is a hyperopic eye. The light is focusing behind the retina, okay? So in order for us to correct this one, we put a convex lens in front of the eyeball or the glasses, okay? So when the light hits that convex lens, it will converge or narrow the light so that it will help the eyeball to refocus the light on the retina, okay? So that it will become normal like this, okay? So that's how convex lens or eyeglasses correct hyperopia. Okay, so that's the difference between myopia or nearsightedness and hyperopia or farsightedness. I hope you learn a little bit from my video, and if you like my video, please click like, share, and subscribe to my channel. And thank you for your time. I will see you again in my next video. Okay, thank you. Bye bye.